Hello, this is Dr. Bar, and today I have a presentation for a live procedure demonstrating the Pshot. But first, did you know that the penile size decreases with age, causing a mismatch with your partner? Circulation in organs will be reduced, firmness and erections will be weaker, sensation may be less, libido may decline. So next I'm going to show the procedure on a cucumber. After that is going to be on a live patient. And you can stop here. It is full procedure demonstration if you don't want to see the live show.
So Pshot, the patient came in, we already did the consent, talked to him about the procedure and what to expect. He's already numb and sterile. Now we're going to inject the penis in multiple areas. The areas that we inject is pretty safe. There's no veins, there's no blood vessels. What to expect after the procedure, that takes about 15 minutes. Usually mild bruising, sometimes swelling, people complain, but they are actually ready to have intercourse the same day. We just say that probably the results within a few weeks. Some people notice results, which is increased erections, increased sensation, issues with premature ejaculation. And also, I guess, one of the most important things is like cosmetic. So some males like to do this for increase of girth and length of the penis. And then here's the after picture. Of course, expectations are explained to the patients because the results are variable. It's very
Okay, so here is the live presentation for a patient that we drew his blood. We spun the serum, we created the plasma, platelet-rich plasma. We can also use stem cells, sometimes exosomes, depending on the patient's case, Botox, as well as hyaluronic acid sometimes for fillers and for cosmetic, and also Botox can help with the length. The results might last for up to a year. Now here is the patient procedure. So we're going to inject, this is the PRP, we're preparing the patient, he's already numb, and we're injecting on the side of the penis with the PRP. This is the area where the erection creates the engorgement of the penis for a strong erection. The serum is injected slowly. This is the area that's safe, has minimum blood vessels and nerve endings. Now the next we're going to inject in the tip. This is the area that creates the enhanced sensation. You guys have a G-spot like us, females, so guys have an F spot and a P spot. This is the area where we inject for improved and enhanced pleasure and sensation for orgasms. And now we're going to inject the exosome. The exosome is the best one when patients have ED or they have need for regenerative for their blood vessels or their nerves. So this is an amazing combination of PRP and exosomes to enhance the results. Another option we have for our patients, if they want to use their own stem cells, we can extract it in the office. It's about an hour procedure. They're numb. We take it from the fat they do not want. We put it in the stem cell extraction machine, and then they can have it with their PRP. This is the patient here now getting his stem cells on the right side, that is red, and on the left side is the PRP that we took from him also, and he's getting an IV with his stem cells. Here we're injecting the stem cells on the side of the penis, the cavernous side. That is also going to increase the girth as well as the treatment for other issues, improving the circulation and the nerve endings. Finally, the patient is asked to be on a penis pump for a couple of weeks. We're teaching the patient how to use the penis pump. We make sure they know how to go up to 10 at the pressure because that would keep their filler and the stem cells and the PRP in place. Finally, to make my point, it is not a painful procedure. Patients are numb. And here I'm injecting. This is a patient that came multiple times. He likes to come every year.
This is the tip one. Does that hurt?
No.
No. We're just enhancing sensation on the very bottom part.
No, it doesn't hurt at all.
Okay, we did PRP, Botox.
So finally, I have a patient who is willing to share his experience. He had the Botox Pshot with PRP.
So let me tell you what the Botox did to me.
Yeah.
Okay, so basically, you know how like us guys, our dicks kind of like shrink in when it's cold or we're scared or like cosmetically, it looks good.
Yeah.
So it's always hanging. Like he's not shy anymore. He's not scared. Nothing scares him. He's always like hanging.
Yeah.
That's what the Botox did to me. Now, is it supposed to do anything more?
So we did the second part of it, which you'll find the result.
Okay.
That's the max that it
So the max is like a half an inch on the girth.
Yes.
Okay, which is not a big deal. And a lot of guys have asked me on my Instagram, like, is this something you do when you're old? And I say no. You could do it when you're 8. Okay, now.
So finally, I would like to leave you with the erectile function index. I would like you to do that score. Later on, I will leave it on the YouTube. So any score less than 21 is mild ED. I would like you to do that to check. Always prevention is better than waiting for later. Thank you so much for tuning in. Thank you for sharing. And thank you for sending comments. And please subscribe to get more recent videos that we'll be sending out every week.